All right, everybody.
Who's up there?
Busy schedule.
We have a busy schedule this evening, so I'm going to bring this Health and Human Services Committee meeting to order. October 17th, 2023, 4:02 p.m. Director McDonald, you have the honor, sir. Come on up here for the office of the agent.
No, you're gonna go here. I'm not moving again. I'm not moving again. Full house.
Oh. These are preliminary resolutions. I have no resolutions this month. So our quarterly report, if anybody has any questions. And what's not on the quarterly report is our EverHome consulting program that we're doing. And right now we've got 38 active cases that are hooked up with monitors and working. And we've got 12 that are in the process of getting hooked up. So we should be at 50, hopefully. These numbers change from week to week. We have people that go into nursing homes or skilled nursing facilities and pass away, then new people come on. So, but the numbers have pretty much stayed the same over the past 3 or 4 months.
They're moving in your favor.
Pardon me?
They're moving in your favor.
Yes, they are. They are slowly, but.
And this year is still out visiting all the different
Yes.
special interest groups to try to solve chronic. Yep.
That's all, like I said, that's all I have. I just want to an update. One of the things we're working on, we've been working with the Veterans Organization about maybe supplying some frozen Thanksgiving meals for the veterans out there. And to make a long story short, the state is just giving us some problems as far as how we want to do this. So the easiest way is we're just seeking donations from people. Okay, they can give us a check. We've already got $200 donated to us, and we're going to pay our kitchen to prepare the meals when they do their Thanksgiving dinners and have them flash frozen, and we'll bring them out to the Veterans Center that way. Because some of the veterans, because you know there are programs around the county where they do serve Thanksgiving meals, but according to some of the I don't know what the widows group, they have a certain name for themselves out there, but Patsy Leader is the one that I've been dealing with, and she indicated to me that there's some veterans that they don't want fanfare or publicity. They just want to kind of sneak in, grab their meal, take it home, and consume. So we're working with her, and we're hoping to come up with about 60 to 80 meals. And that way, they'll last through the holidays too if they don't all get used Thanksgiving. So, if anybody knows anybody and wants to make a donation to us, we'll be willing to take them. So, but that's all I have.
For a C note. All right, terrific. And the heat. Remember, I asked a question at the office.
Oh,
so they're increasing the threshold, but decreasing the funding per individual. Is that what I understood?
I don't know. We're just processing them like crazy.
Yeah,
they're coming. It's like a revolving door. We're like, last year was the record year for us, and already we're just for the month of September we're like 60 some cases more than last year. So, but we're keeping up with it. I don't know about DSS. I don't think.
Yeah, Chairman, the revenue is there to offset the expense, so they went out together.
Okay.
There's a lot more work if we get more.
Right.
But the funding is there.
Yeah, it was just the income threshold went up a little bit.
Yeah.
Right. Yeah.
Terrific.
Did it go up more than the cost of living? So it's neutral, basically.
It seems like it's neutral.
Okay, so the Social Security or whatever benefit they're receiving would have gone up about the same amount. Okay.
All right, any questions for Director McDonald? Thank you, sir.
Thank you.
Up next, Department of Health. We're just asking if you brought your syringes so you could take care of this group of county employees.
You don't want me to give you.
She's honest about it.
Good evening, everybody. Got a couple resolutions here today. First, request permission to transfer funds to purchase COVID-19 vaccine. That should be.
Second.
Further discussion? All in favor?
Aye.
Opposed?
Are you transferring, because it says increased revenue, so are you getting money from,
So we will be billing insurances, so we are expecting that we will have be increasing revenue as well.
so you're amending your budget? Technically, you're not transferring from one account to another?
So we have to transfer it to purchase it,
Okay,
so it's the upfront cost.
so I just need it, so I can put it in the resolution
Yeah.
properly? Because right now you're just increasing both of these revenue lines, but are you transferring it from a revenue line into a?
You're transferring it from an appropriation into another appropriation line or just?
So, yes, we're transferring it from, one of our contractual professional services line into our vaccine purchasing line.
Okay. And then. you
And then our
create
revenue,
lines.
we're expecting our revenue to increase
Okay.
based on what we,
Okay. I don't know if it reflects that, right, but I'll check.
Yeah.
on it.
So the contractual is probably, is who you get the vaccine from?
no.
Okay, sorry.
Sorry.
Well, I'll confirm with Jen because
Okay.
it just shows, like down here is the transfer,
Yeah.
Right,
from one account to the other. And these are the revenues, which is generally you're accepting 110,000 to increase those two
Right.
revenues.
I
So,
understand what you're
Yeah.
saying, so we need to fix that.
Yeah,
But the idea,
correct, is approved, once you accept. I'll check.
Once
with
you get the numbers.
Adopt the resolution.
Right.
Spirit.
once,
Yeah, exactly.
yeah,
I just wanna make sure I
Still
say
gotta
that
get
right.
done no matter where.
Yeah.
where- so-
Good eye, Kelly, as always. All right, all in favor of? Aye. Opposed? Carried.
I'm sorry.
And
about
that's
that
Pfizer
confusion.
right now that you're starting with and
Yes,
maybe
so we
Moderna to
almost
follow.
have all of our Pfizer in. And we are still working on a Moderna account 30 days later. So I'll talk a little bit about that shortly.
Okay, terrific.
Request for permission to transfer funds to cover preschool transportation costs.
Do I have a second?
Second.
Further discussion? All in favor? Aye. Opposed? Carried.
See, that looks like a transfer to me.
Yeah.
Thank you. Request for permission to authorize renewal of annual
I'll move it.
contracts.
Second.
Further discussion? All in favor? Aye. Opposed? Carried.
Right, and request for permission to authorize renew annual contracts for grant funding.
Move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Request authorization to renew affiliation agreements with colleges and universities.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And request authorization to amend resolution number 142-2023. So this, is our, CDC infrastructure funding. It's just how the, contract was issued. There was some, back and forth between them, but I think we've sorted it out and,
The county attorney had a problem with the wording because the amount,
yeah.
so they asked.
It was,
us to
the
amend
amount
wording.
only listed 10% of our actual award, and of course, the county attorneys, that would not be, appropriate. So we've worked with them to fix that so that both the state and the county attorneys are happy with the
There wasn't
resolution.
a copy of that in the packet. Was there?
No, this was I sent it out last minute. It was kind of a last minute,
Okay.
revised.
This is one of those grants that began in November of 2022, and we've gotten a contract now. So,
Almost done.
And it's bolstering personnel, right?
but that,
Used to bolster. personnel.
yes, recruitment, infrastructure, public health infrastructure is
Okay.
the deliverables on that grant.
All right, any further discussion? All in favor?
Aye.
Opposed? Carried.
And then we have director's report, sorry for the order there. Lots of, communicable disease as usual. We've got a couple flus in. We're not at widespread influenza outbreak yet. But we're probably getting there. Lots of foodborne still. We had 3 unrelated salmonella, several campylobacter, 1 vibrio due, to raw oyster consumption. COVID outbreaks in facilities. Some of them are doing surveillance testing, but some of them are due to symptomatic patient or residents. So we're keeping a close eye on that. We had 110 cases in September. And then we are still navigating the new formulation. We've gotten Pfizer vaccine in this week. We've got a formulation for 6 months to 5 years. We've gotten formulation for 12 and up. We're still waiting for that 5 to 12 formulation. We're hoping to really go ahead with our planned vaccine clinics next Thursday. We're going back to AB Shaw Firehouse. We'll be doing COVID and flu there. We're going, as soon as we have all that vaccine in, which I'm very optimistic that it is before the end of this week, and hopefully, you know, arriving now or maybe tomorrow, we'll start pushing the registration links on our app, our website, our social media. So we really appreciate any support in sharing that from you all as well.
We doing a flyer?
A flyer?
Are you, because you could say, digitally, we could send them out to our email address.
Sure, we can do that for you. Yep. Let me just make note of that.
And that will just be with the Pfizer and the flu, right? Not, you don't have the Moderna.
We're hoping, I mean, so we were working with Pfizer directly this time. Again, I mentioned, I think last month that we did not have accounts with Pfizer and Moderna because we never needed them before. We got all our vaccine previously through the federal government and the state. So this time we had to set up accounts with those manufacturers, and it has been a little ridiculous. 30 days later, and we still don't have, we have not made any progress with Moderna. They say they're overwhelmed. I'm not sure how they didn't see this coming, because we all did, right? So, you know, it's, there's definitely a lot of frustration on our
And it's interesting because we have all this vaccine sitting in pharmacies who are making appointments 5-6 weeks out, but they have plenty of supply, but they can't handle the people coming in over the counter. And you could handle the people in big numbers.
Yeah.
We went through this 2 years ago too, you know, we could have handled it better.
Do you see in the near future there being a vaccination clinic, maybe at one of the county buildings, the way it had been done previously? I remember last time I got vaccinated was at 325.
Sure, we can talk about that.
Oh, okay, or should I sign up for the?
If we've got, you know, they're right now doing flu clinics in our lobby, so we can, yeah, very good, like, so we can talk about that, yeah, certainly.
We have RSV at the AB Shaw, not yet.
Nope, no, not yet.
Do we have a timeline for that?
Not at this time. Hopefully we'll have more information on that soon.
All right, we have a question from the supervisor in attendance. Go ahead, Tisha.
So in the past, the Department of Health has come to New Lebanon because we're a good half hour from any of your vaccination clinics and
Yes.
a half hour from any pharmacy.
Yes.
I did email Christy, who's the person that I've emailed in the past and did not hear back.
Yes.
Would love to do a flu and COVID vaccine clinic. We've done it at the town hall before. We've done it at the high school
Yes.
before.
Maybe
I
we could do
work
a joint
with
setup.
them and
We
give
do
you
a
a
joint
link.
Yeah.
So
Well, I
we
think it's
have,
open to everyone because we had Steventown residents come.
so we have a clinic scheduled there for next Thursday at the school. But it is
COVID
open.
clinic?
No, this is flu. It is open to the public. But we've only had 2 registrations there, so I was hoping to reach out to you.
And is
when
there
we
a
have-
reason if you're coming out with nurses anyway that you can't do COVID as well?
So if we've got the vaccine, absolutely.
Okay,
But we will have to charge insurances for both flu and COVID.
right.
So we will have to have that pre-registration piece in order for that clinic.
So I can help advertise it. I didn't even know about it as.
Yes, I was actually, I spoke to them this afternoon, and when I got that information, and you're on my list to reach out to share that
And
information
you
with.
add COVID registration to the flyer or the email, we'll get it out.
As long as we've got it all sorted, yes.
Oh, you don't have vaccines right now?
Well, we got it, you know, today, and hopefully tomorrow we'll have everything on hand.
Okay.
But-
Great. Thank you.
So I'm making note of that too.
You're still requiring vaccine cards. I wonder where mine wandered off to.
No, that's been, discontinued. It is not a priority.
You don't have yours on your phone?
I took a picture, yes, but it's probably 1,000 pictures ago. I didn't put it in a convenient folder. All right.
Yes, so that's that. Do you have anything else to report on?
So if you're checking insurance, I'm sorry, how does this work for Medicaid patients? If they're,
So it's tricky.
Yeah.
We have, there are certain plans that we can work with. And, the supplemental, it's extremely complicated.
so I'll call you for an offline conversation, so we don't waste meeting time.
Yeah, I think so.
Because I have a number of Medicaid residents.
Yes, definitely. We can chat about that. Wastewater is down. Again, that's just the city of Hudson. We did experience a death, unfortunately, in September. An older individual. They were vaccinated, but did not have the bivalent booster. Lots of comorbidities, but unfortunately, that brings our total up to 182. Tick-borne illnesses are still, pretty normal for this time of year. Into fall is still an important time to be, vigilant about checking yourself, checking your animals. We had 2 rabies submissions, both negative, a bat and a cat. No new post-exposure vaccines in September. Environmental health, 31 healthy neighborhoods visits, several food inspections, migrant housing, public water, temporary residences. Vaccines, 193 patients, 239 vaccines. We've worked on our migrant labor camps. 53 vaccines administered to 42 workers. That's wrapped up now. That's all pretty normal for this time of year. Preschool and early intervention. Referrals are down to normal post-pandemic. Preparedness and public health education are all operating as expected. 111 pounds of sharps were collected through our sharps disposal program. That brings our total to 1,061 pounds year to date. No referrals for our maternal child health program. And one car seat installed. So that concludes my report. And we just have one more request here for a conference. Request for permission for Elizabeth Neal, RN, to attend the National Association of City and County Health Officials Essential Skills, Creating Safe and Inclusive Clinics.
And they're paying that whole.
It is fully funded.
But
by ACHO.
it's before the committee because it's out of state travel, so there's.
Yes.
I'll move that.
And I'll say,
Further discussion going down to Hotlanta, all in favor? Aye, opposed, carried. What's the potential for the issuance of free COVID test kits as we get into deeper cold weather and more congregation?
We've got lots of test kits. If it's not in your email now, our preparedness specialist will be reissuing, a letter, an email of interest, whoever's interested. We've got a lot of test kits, and they come in like a 2-pack. They're not the big boxes anymore.
I'm handing them out of those,
Appreciate
that big box and like taking pictures with
Yes,
directions.
I knew you'd appreciate that, yes.
People, yeah.
So we've got lots of them.
Are you working with emergency management on that?
Yeah, so yes, John worked closely with everyone over there.
So
Yep.
there should be an email out about that.
It might be waiting for you right now.
Okay.
You might have not have done it to today, and it might be tomorrow, but it's coming shortly. Okay,
All right, any more questions for Director?
thank you.
thank you very much.
Thank you.
Thank you. Up next, we have Human Services, Director Almasi.
Good afternoon, everybody. Nice to see all of you.
Nice to meet you.
Thank you. Total of 5 resolutions today. I believe it's 3 financial resolutions, yeah, and then 2 general. The first financial resolution has to do with purchasing laptops. I've been advised through information services that they would like to rotate the laptops as the warranties expire, purchase new ones, and use the laptops with the expired warranties throughout the county. So we'll be using federal salary share dollars for this, so there won't be any direct expense to the county. I ask for your support in this resolution.
I'll move it.
Second.
Further discussion?
How many laptops are we talking about?
30.
Does it say there 30,
Yeah,
give or
it's
take?
like
I was wondering, I was looking at that number, so I was like, thank you.
I agree, you can look at my cheat sheet.
All in favor?
Aye.
Opposed? Carried.
Thank you for your support. Next resolution has to do with transferring funds to cover shortfalls. So it's bulleted out there. I can go through it, but we're just moving money from one bucket to another here.
Move it.
Second.
Further discussion? All in favor? Opposed? Carried.
Thank you. Third resolution is to contract with Jackson and Coker, a recruiting service that we already have a contract with, but they have brought us a psychiatrist as a candidate. Our current prescribers, both psychiatrists and nurse practitioners, are at capacity. This is a good thing. We are admitting more patients/clients into the clinic. So in order to expand our capacity by 21 hours, I put out the call to the recruiters. I was hoping they would bring me a nurse practitioner because they come at a lesser cost. The cost, as you can see, is $250 an hour. The silver lining here is that the recruiter is not charging us any finder's fee, which can be upwards of $15,000, $20,000. But it is a steep hourly rate. We currently have a prescriber that is at that rate, and they cover their cost by the revenue that they bring in. I expect the same to be happening with this prescriber as well. So I ask for your support to allow us to expand our prescriber capacity by 21 hours.
I'll move that.
Do I have a second? Further discussion?
Just a question.
Yes.
I don't want to look at get to a certain amount, but why did they not charge us a fee? Is it the level of?
Well,
is it the rate?
I put up a fuss about the hourly rate, which they pushed back on, saying that's, the market rate, that's what it's going for. And I know that, but I just felt like putting up a fuss to see what I could get. And what I got was waiving of the fee.
Good job, bro.
I love these hard negotiators we have at the county.
I try my best.
Well done.
Thank you.
All in favor?
Aye.
Opposed? Carried.
On to the general resolution. This is a request to contract with another recruiter who's new to us. The asterisk here is they not only recruit for nurse practitioners, but this is unique in that they recruit for licensed master's level social workers and licensed clinical social workers. We're doing well in terms of our staffing, our clinical staffing at the moment. What we're missing is the LCSWs, the licensed clinical social workers. We need more of those to see folks that have certain private insurances as well as Medicare. We're making do, we're okay, but this was appealing to me and I just wanted the option. Again, if we exercise this option, it's a larger conversation with UPSCU and such, but it would be nice to just have this in my back pocket. So I ask for your support in this regard.
What do we currently pay our LCSWs?
LCSWs? It's competitive. I believe it's in the high 70s.
Do I have a motion?
Yes.
Second?
A second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you again. Last resolution is involving the satellite, well, it's not a satellite, services that we'll be providing to Columbia Green Community College. You may remember last month I presented a resolution asking for your support for us sending a staff person there. At the time, the college was telling me they would be able to offer some $24,000. In the meantime, they've increased that amount to $31,500. So I, after getting some consultation, was told to submit a new resolution reflecting that. It's going to end up increasing the number of hours that we're able to offer the college, which is a good thing. And the staff person that I tagged for that duty is able to accommodate that.
I'll move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then, I know we're on a time crunch here, but I did want to talk with all of you about the work group that I was asked to create by you with regard to the opioid settlement funds and where we are at, excuse me, with regard to that. So we offered a total of 4 community listening sessions throughout the county. We covered all, corners of the county in doing so, and we received feedback. And since then, that ended in May. So between May and now, we've been meeting as a group to kind of digest the feedback and what we heard and what, we were told. I can break it down into pretty much 4 buckets. One of them, and I'm here today to make you aware of this, to entertain questions, curiosities, and ultimately to get your support to start taking it to the next level in terms of planning and getting into the specifics with these different directions. The directions being, 1, Oxford House. For those of you that are not familiar with Oxford House is a nonprofit entity. It's a sober living environment. It's peer-led. So the way this looks is Oxford House International comes into a community and they work with a landlord in a desirable neighborhood, not an impoverished neighborhood. They really emphasize finding nice homes in nice neighborhoods to then take out a 2-year lease. The house is then occupied by 6 to 8 individuals who are in sustained recovery. So these are individuals that maybe have gone through Twin Counties or have maybe gone to detox and inpatient rehab program and made it through the red door. The red door is the step down that one would go into that's managed by Twin Counties currently. That's for men. Riverside is the women's residence. The thing is that those individuals have nowhere to go once they leave Riverside or Red Door other than the environment that they came from, which is often not very pleasant or desirable. The Oxford House would be a step down, in between Riverside, Red Door, and going back to, their home that they left to get sober. The way this works is there's a coordinator that works for Oxford House, and they work with the landlord. They do the lease. They work with the providers in the community to find the 6 or 8 individuals that are going to occupy the house. The individuals that occupy the house all have a role within the house. Some may be the house manager, the treasurer, the secretary. Everybody has a role and an accountability. The way the expenses of the house are paid for is that the individuals, whether they're on disability, social services, or have employment, contribute to the overall monthly expense of the home. And there's accountability in terms of if an individual relapses, they're given an option. Go to the recommended level of care to stabilize your recovery, or which then you would be welcome to return to the house once you complete, or you have to leave. And then that makes room for another individual to occupy the house. The cost to the county for this would be the cost of the coordinator plus the startup cost for the house. What Oxford House is telling us is that the annual cost would be approximately $160,000, $140,000 for the coordinator. Not that is their salary. There's an administrative fee to Oxford House Incorporated, of course, as the overseeing nonprofit. And there's the salary. And then there's about a $20,000 startup for each house. This model works in that if you fill up a house and the need in your community still exists, then you open up another house and another house and another house. The beauty of this is I've spoken to my counterpart in Greene County. His name is Jason Fredenberg, and he's spoken to his county administrator, Sean Groden, and there's interest in splitting the cost. Because the way I see it, we don't need a full-time coordinator through Oxford House. We're a small county. We're not like Dutchess and Orange County that have recently partnered with Oxford House for, I think it's 4 or 5 houses, maybe as many as 6. Sure, they're going to keep a coordinator very, very busy. But here in Columbia County, we wouldn't have enough houses going on to necessarily keep a full-time coordinator busy. But if we split this cost of $160,000 between Columbia and Greene, I think we're on to something there, and we can set up houses in both Columbia and Green. Yes, Supervisor.
Are they single sex dwelling?
They can be and they can not be. There is flexibility. There's also flexibility that if a individual's working their program or recovery, so to speak, and let's say they regain custody of their child, that child would be welcomed into that environment. It's not like that would be prohibitive to that individual. Then they have to go find housing elsewhere. An individual can stay in an Oxford house for as long as they want. Many of the people that we've been interacting with to learn more about Oxford House are in fact individuals that have resided in Oxford House, and Oxford House has been a big part of their recovery. All of them no longer live there. They own their own homes. They work for Oxford House, etc. So this is something that I think is definitely worth giving a shot, as opposed to going the route that we've tried, which is to, you know, pursue getting capital funding through OASIS, the Office of Alcoholism, Substance Abuse Services. There is a lot of bureaucratic red tape involved in that. I think this is a good investment of the opioid settlement dollars to see what it can yield. Worst case scenario, I'll be honest, it doesn't work out. It doesn't work out. We don't do it. Year 2, year 3.
You don't renew it.
Exactly.
But Oxford House will let you manipulate the coordinator positions,
Yeah,
so you're not
that's
strictly
what we're
required. Okay.
Yes, I right off the bat, I said, you have to entertain us, allowing us to split this between the two counties, and they were agreeable to that.
So if it didn't work the first year, what if we had populated a house? What would happen to the people in that house?
Well, what we wouldn't do is we wouldn't pay for the coordinator, and, you know,
But Oxford House didn't have an obligation to continue the
the
service?
house would run itself organically, because let's say the 6 or 8 occupants would all have a job. If you went to college and you had like an RA, a residential advisor, like they were at the top of the dorms, and then, you know, you have your secretary, your treasurer, and so on and so forth. Those occupants would keep the house going through the built-in accountability and responsibility that they place on themselves. The coordinator position is intended to work with the provider community, come to meetings like the Community Services Board meeting, get to know the providers, maybe work closely with the clinic and the Mental Health Association and the care coordination programs that we have, and the hospital as people get discharged in Twin Counties, as people are getting ready to leave the Red Door in Riverside, to make sure that they're interviewed for their appropriateness and, you know, keep the place full, so to speak. But technically, the house could do that itself. But having the coordinator gives increased probability for success, that the house is kept full, and that additional houses are created as necessary and indicated. Because if that one house is full for an extended period of time, and the providers are saying, hey, we have more individuals that need this, then that coordinator goes and works with the landlord that provided the first house, or finds a new landlord to offer a second house, and so on and so
But
forth.
the additional cost or add-on is $20K, not a,
20K
assuming
to-
it falls within the same 12-month period.
Right, because, no, it's 20K to start a new house.
Right.
Because think about it, you have to furnish the house, there's dressers, beds,
No,
utensils.
but the coordinator's on board for a year. The 140 is for a year, right?
Yes,
So any additional houses would fall under his or her responsibility.
yes, at $20,000 a pop.
Okay.
But the same 140.
Yes,
Right, so I guess
Whether
I
you do
think
one
your
house
point
or 4
is if
houses.
you're doing one house, it seems like a lot of money to pay a coordinator versus
Right.
if they had
Multiple.
4 houses.
multiple, correct.
I mean, the way I figure, and this is
Especially if
honestly,
you're saying,
yes,
excuse me, that the house could take it over after a year because they would be self-sustaining.
right. We don't know. This is a new model to us, and my counterparts in Orange County and Dutchess County have signed contracts with Oxford House for, as I said earlier, I think, I'm not sure if it's 4, 5, 6 houses, but again, Orange and Dutchess are much larger than us. The population is much greater. But you know, this is an evidence-based model. Nobody's asked about that, but I can share that with you. It's been studied by, I believe it was Temple University. It is throughout New York, throughout the United States, and even internationally based. So, again, I can bring you more information about it if you'd like. I can invite the representatives from Oxford House to come to this meeting. I'm sure they would be happy to do that, to answer questions. But I'm asking for your support to take the next step to pursue this, because I do think this would meet a very important need in terms of the step down process that recovering individuals need to go through. To go directly from detox or rehab back to the environment where they came from is almost, I hesitate to say a guarantee for a relapse, but for many people it would be. Riverside and Red Door are a good interim between those higher levels of care and going back to the environment where you came from. But it would be even better to have this additional step down where it's self-governed and people are holding each other accountable, and the emotional maturity
Something
can
you're doing
develop.
with your opioid funding.
Yes, that is what I'm proposing, Supervisor. Yes.
Is there an algorithm for the length of residency? Like, is there a
Stays
minimum?
long. People have stayed years, people have stayed months. It's really when you feel ready to leave and be on your own. So let me get to a few other recommendations. I know we're tight on time. So prevention services. This came up resoundingly in each of the community listening sessions. The participants were telling us we need more prevention. And I was happy to tell them at the time that, well, you know, Columbia County has secured Twin Counties as its substance abuse prevention provider. Now, as a reminder to all of you, we only receive $140,000 in state aid for the substance abuse prevention services that are offered to Columbia County residents. That basically covers the staffing and the personnel, which is, it was 1.5 FTEs. Twin Counties and Tara Van Roy, who is the director of the Twin Counties Prevention Services here in Columbia County, have expanded that, but I'd like to support them in taking the prevention services beyond anywhere that we've taken it before. I want to bring it beyond the schools. I want to have Tara bring it to adults and communities, and just really subsidize, supplement it with some of this opioid settlement money. We haven't gone as far as hearing from Tara as to how she would take it to the next level. She has ideas, that much I know, but I don't know a dollar amount, how much, you know, she asked of the opioid settlement, how big of a chunk of the opioid settlement dollars she would request. And we can start small and start with a few projects beyond what the state aid affords us and see how that goes. And then maybe increase the subsidy in year 2 and 3 and so on and so forth. And the last thing I will bring to your attention for the sake of time is, and this is a thing that we've been trying to accomplish for many, many years. It's very challenging, but again, unanimously at all of these conversations, community members told us we need a clearinghouse. We appreciate the fact that everybody has a warm line, a hot line, an 800 number, a this, a that. But when we are in crisis as an individual or our loved one or our friend or whomever is in crisis, we do not know where to turn. We are confused. We are unsure. We are uncertain. To give us one number, one place that can be marketed adequately throughout our community so that it becomes part of the fabric of our community. Everybody knows, okay, if I have a question, if I have a need, if I have a concern, here's the place to go to. And then that place can either answer the question or direct the individual to the provider that has the specific information to help that person. But they were very clear with us that it's incredibly overwhelming, and they appreciated our good intent and goodwill to try to help with all of our crisis lines and warm lines and this and that. But in that moment of confusion, it's overwhelming for them. So we're going to try to land this with a provider, support them with funds, whether they need to bring on an additional FTE or something like that. It wouldn't be a 24/7 type of thing. It would probably be business hours, and with the ability to leave a voicemail so that the person would follow up the next day with that individual, and just make sure that whatever question they have, whether it's food insecurity, children's services, mental health, substance abuse, you name it, an answer would be given, and the mystery and the question marks would be alleviated. So that is something we're going to try to tackle, and that's a big nut to crack because it's not as easy as you think. I can assure you of that. Otherwise, it would have been accomplished.
There'll be great reference for all municipalities in this county too, to have that phone number and be able to
Absolutely.
recommend people in the direction.
And there are things out there. Some people have said, well, what about 211 and 988? I won't go into detail about my thoughts and opinions on 211. It's okay. It's okay, but we're small enough that I think we can do this and we can make it our own and do it right. 988, the National Suicide, hotline number, it's plagued with problems. I wish I could speak favorably and positively about it, but it's problematic. So I don't feel confident in telling people to call 988 to learn about Columbia County. Because by the way, our call center is hundreds of miles away from this county. And yes, we gave them information about our services, but they're just looking at a spreadsheet. We can handle this. We need to handle this for our residents is how I feel. So those are the directions that we're looking to pursue, and that I ask for your support. So.
I know we don't have a lot of time, but I just, firstly, thank you for bringing that to us. I think there's some great ideas here, but was there any concepts brought up that would affect more individuals, a larger group of people, as opposed to like the opioid house is 6 families or 6 individuals, was there any thoughts to something that would affect a larger amount of people with that money? It's a lot of money and it goes on for quite a few years. So I didn't know if there were any other, without beating this right now.
Right,
just
you got it. I appreciate the question. So the short answer is, yes. For example, we are still pursuing the wellness hub, which I think will benefit a significant number of people. We used a separate bucket of money known as the opioid abatement money that comes to the Columbia County local governmental unit to support Lori Corgeson being brought on board as the coordinator to continue to pursue that. And in the very near future, we're going to be having a meeting with the governor's office to discuss how we can evoke their support to help us cut through the bureaucratic red tape of the O agencies, by OMH, OASIS, etc., to get capital funds, to get support, to if there's regulatory or bureaucratic problems that we run into, how can we count on their support to get guidance and help us so that we can one day have a homeless shelter, have additional housing, have that welcome center where maybe this provider that operates this clearinghouse could be located. And there was even talk of relocating the Department of Human Services so that it's proximal to that hub element. And yes, we will be receiving additional abatement monies for the next 16 years, much like the disbursement of the opioid settlement money as a result of the class action lawsuits. There's still time for other projects to be talked about. Yes. Okay. There's something that I didn't get into, which I guess since you asked, I'll touch on it. Sorry, we need something called flex funds. I'll call it a slush fund of opioid settlement monies that we can use in acute situations. We have circumstances that come to our attention, and it's always on a Friday afternoon where somebody needs to be housed, let's just say. And we turn to our partners at social services and they say, oh, we'd love to help, but that individual has a sanction. They have a severe sanction, a level 1, 2, or 3 sanction. And that prohibits us from housing them at this moment in an immediate sort of way. They need to comply with Twin Counties, or they need to comply with mental health. Well, that's not going to happen that quickly on a Friday night, but the person needs to be housed. So what do? We would like to have a certain amount of money available that we can access rapidly to pay a hotel owner to house them, or somebody to put them up. Or, that's just a housing example. There's other acute needs that come up, and we would like to be able to have a way to vet these individuals quickly and cover their expense and costs so that they don't have to be in limbo because of the bureaucratic hoops that prohibit us from helping them in a rapid huge sort of way. But we have to suss that out, and Commissioner Gibson and I are, you know, in conversations about what that would look like, and when we have it figured out, we'll bring that here to you.
Is that the fourth bucket?
That was gonna be fourth bucket. Thank you, everybody.
Thank you, Dan.
Just a question on clearing this idea. If that were to come into fruition, would that be in competition with community action or Operation Unite?
I don't see it as, no, we,
All the services that they provide, you don't think?
well, we might, again, I wanted to bring it here. The next step, if I have your support, would be to create a work group of individuals to discuss who amongst the community providers might want to take this on. You know, maybe one of those two would be interested to fold it in. Why reinvent the wheel? Why start fresh? But that's the next phase of the conversation. So final question, do I have your support to pursue a more in-depth conversation with Oxford House and things like that? Or would you like me to invite them to come here before I go in that direction?
I'd like to hear something.
You would? Okay, I'll reach out to them and I'll have them come hopefully in time for November, but maybe then in the new year.
And maybe you want to schedule it for like maybe a half hour before the
Yes.
regular committee meeting or.
Oh, okay, so
You
we'll
know.
burn into the time. That's a great idea. Thank you, Kelly. Thank you, everybody.
Thank you, Dan. All right, next up, social services, youth development.
All right, the first
Commissioner
few
Gibson.
requests are, to fill positions and to backfill any,
I'll move it.
Second.
Further discussion?
I haven't even said one yet.
Yeah.
We can read.
That one.
The transportation.
Excellent.
You want to do the
Keep
two?
going.
All in favor?
Aye.
Opposed? Carried.
So you said the first three.
Yep.
Okay, so four. Okay, so we'll go on to number 4.
All right, request authorization to create.
I'll move it.
Okay.
Second.
I can't sign that fast. All in favor? Opposed? Carried.
We're tabling number 5. Number 6, requesting authorization
I'll move
to,
it. I'll second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
request authorization to enter an agreement with Community Health Aid Services for the provision of private duty nursing.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
List of our contracts in Mass went out, just ask for approval for 2024 to move forward with those.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And my deputy of finance needs to transfer some funds between two lines, and that requires a resolution.
I'll move that.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
I had come originally, we were going to discuss the MDT. I'm going to put that off again because for two reasons. I'm going to just very quickly talk about my overtime and my on-call stipend. That will go very quickly. And then Supervisor Eldridge would like to talk about something that we too would like to talk about. That may be an executive session. So but prior to executive session. So we have a stipend that we entered into. We agreed with the union for our on-call folks. This is our Children and Family Services. Takes extensive CPS training to be on call, and we're on call every night in the year, right? So when we're off the clock at 4, we're on call until we're back on the clock at 8 o'clock. Okay. We have a certain stipend for that. And it's a bit outdated, so I want to increase that overtime stipend and also take certain members from the Adult Protective Services Unit off of the Children and Family Services on-call and just have them deal with the homeless issues that come up. So it's an entirely separate on-call system altogether because it just requires that at this point. So I will have a much more pinpointed Children and Family Services on-call and an Adult Protective Services on-call. So the increase is about 36,000 a year. So what I've done is reallocate overtime monies that I had in one pot over to the stipend and cut it in another pot. So it's a new budget neutral shifting of the funds. And with us about to start a 9-day work week, I expect the regular overtime to have fallen anyway. So, that's an awful lot of inside baseball if you don't work at the agency.
I'm trying to write it all down.
But,
As long as you're not
It makes us
compromising the
better.
services that you're cutting, right?
no, we're increasing. No services are being cut in. We're actually going to enhance them, and we're going to be paying more for the people who are out at 10 o'clock at night.
So you're
Is
just
the
looking-
on-call stipend a different amount for those two different
They are.
descriptions?
They're different.
And this is just gonna be a more reliable or stable allocation. You know you'll have people to provide both buckets of services.
Absolutely.
That's what I was thinking.
Did that have to be negotiated, the stipend?
It did. We went back and forth, and that's not something I'm bringing. I just wanted to bring it here so that everybody was aware that that's,
Michael's aware of it.
everybody's aware.
Okay.
Yep. So I'll put that'll be something that goes into place January 1 when the on-call, when the 9-day work comes. But we've done all the shifting at the budget level to know that was coming, and I just wanted to make sure that this group was aware of it. Okay? And then otherwise, I'm certainly ready to get
Move
into
to go into executive session. Leaving with the contractual.
We want to do Dan first.
Why don't we get, Dan, do you have one thing on the agenda? Let's just take care of youth development, then we'll go into executive session after that.
Contractual, what would it be for
Personnel?
personnel? No.
No, there's a blanket one. It's
for the on-call.
For the executive session.
discuss the personal, private, credit, financial
Yeah.
history.
A contract.
Okay, contractual, okay, thank you.
Thank you, Chairman. Okay, so just to kind of come some updates. We had our advisory board meeting last week, and Operation Night was the guest speaker. So our entire board learned about the Operation Night program. So each meeting, we have 4 over the year. We'll have 4 different programs each year to communicate with our board. November 1st and 2nd, I'm going to go to the New York State Youth Association Conference in Syracuse, totally paid for by the state. Think Differently program. Just a little feedback. Dan, Director Amasi, went to a training down in Dutchess County as well as Jen Depew, a couple of Jen Depew staff, and they felt it was really impactful and effective. And that's part of our budget. So we're going to look at doing that in April. We're going to tie it together. Dan has a contact there in Dutchess County. It's much less expensive if you tie them together. So I think that's what we're going to look to do. The Bindlestiff Circus, they're going to wrap up their last program this Saturday in Germantown, weather permitting.
Yeah, right.
Be wet.
Let's see.
They did it in the rain in Stockport.
That's what I was gonna say, it's gonna be raining.
And
rain dates.
checks for our transportation municipalities for the summer programs as well as our not-for-profits. All the checks are out and should be arriving soon. The only thing I'm waiting for now is the program annual reports from each funded program, and then we can close out this year and start it's already started 10/1. Let's see. We were able to help out in Chatham with the pickleball courts, right, Chairman? It looks like we're going to be able to help the Hudson Youth Center as well. Senator Hinchy is interested in expanding their kitchen because the amount of kids they're feeding down there warrants it. So it looks like we're going to be able to get another grant via that.
Yeah, the one for Chatham just transitioned from the senator's office to DASNY.
Good, perfect. So this would be the same process as well. What's interesting is, you know, I get to bring the programs to Commissioner Gibson, and he seems to have the money to fund them. So we were able to do the boxing program, the Minnesota Circus, and now we're doing the badminton program down at the youth center, for 4 hours every, it looks like we're gonna try to move to Sundays because Saturdays, not getting the population there, but, so that's another program that's helping the youth bureau, but it's being funded from social services. And the other, thing is the youth leadership, award banquet. So it looks like we settled on May 23rd as the date. We have Christine Grossman, who, if anybody went to the Greenport party last week where you had like an unbelievable dinner from Christine. She's gonna do it as well. And what's great is the Spark of Hudson's gonna fund the entire event. So that was a big one there.
That includes all the school districts in the county.
Yeah, so I reached out to all 6 schools, to their guidance counselors, and they're all on board. So right now, I'm working with Sherry upstairs. She's helping me kind of format everything to make it look professional, so we can send it out. Start January 1st, we're gonna start getting out there.
Terrific, thank you.
Before we go into executive session, I see we have some bills here. So I did want to touch on another thing that I did forget to bring up. There's been some concern about the youth clubhouse because they've been operating, at 11 Ward Street, and that's obviously in transition at this point and moving on. So we did put a committee together. And I do have some leads. I spoke with a message from Mr. Rossetti today. We're in discussions with St. Mary's Church, so we're endeavoring to work as quickly as we can to make that transition over. And I appreciate everybody's support on that, and we've got some good support on the board to join that search. So it looks like I'll be meeting with St. Mary's this week, and to just talk about different options we might be able to do there. But, at VSS, we greatly support the youth clubhouse. Obviously, what it does, it brings some great programming to the area. Guy Hillman is here. He runs the program. He has been working with VSS for years. So we're very happy to work with these good folks, and we are going to make sure we transition over and keep that program going.
Sorry, how does that space sound to you guys?
Yeah, but, not to have space down, I've been in it, I think it would need to get a little deeper into the right out the first. And I appreciate the efforts, definitely. I think for me right now, my biggest stress is continuing programming. How do I, from now until November 30th to transition and like have a seamless move for these young people and old people and older people in recovery that we work with is how do we do this as smooth as possible, like knowing the inevitable, right? Like it's a huge burden and stress, and everyone knows how hard it is to find space with Hudson affordable schools. I mean, you don't know the issues, I'm sure. So any support would be extremely helpful.
This is a suggestion for the transition period, like programmatically, I think, make it a service oriented period, right? Like have your clientele on site other places doing things instead of regular programming, and then maybe it would offset some of the, like have them at the soup kitchen or giving food service back to the community so they're not stationary at the clubhouse.
Yeah, definitely. And again, I definitely look into suggestions and all of things. Anything anyone can offer. We are designed to be a drop-in center, so even programming looks different than other programming because our programming is a safe space for people to drop in, and a lot of times they're not wanting or able to engage in formal programming. So literally sometimes it's like letting a young person see on a campus. So it's very like low threshold services that we offer, as well as, engagement. So we do all of that.
So Bob, I have a question. I want to thank you for your efforts. And I know like the first step was like, we need a new home. And so this might be like pie in the sky wish list, but from what I hear with this programming, like there's a lot of transition that has happened over the years. So if there's any conversation that can be had, if St. Mary's is the new space for like a 2 or 3 year lease, something where we can guarantee that this is the new space, not just for the next months till then something happens at the church that they need the space back. So I don't know if that's been discussed at all, but in an ideal world, we would not only make sure it has the infrastructure that is needed, whether it's furniture or renovations or whatever, and obviously there's lots of sources of funding through Dan, through your office, through Mr. Almasi. I mean, all of this ties into mental health and social support and all of that. But maybe also conversate with her, can we ensure that this is like a longer term home for them?
Well, we certainly want to do that. We're in the very early stages with St. Mary's. I brought up an excellent point, which is why I asked David Rossetti to join our group. There's a dedicated group of supervisors, Dan and myself are there. But really to have Mr. Rossetti there, because we've got to discuss what's needed, what's it need to look like, what's the time frame, and of course, lease. And I hope St. Mary's, I don't know that. This is a very early part of the discussion. They're no longer in a lease with the school out at Hawthorne Valley. So I thought, well, this is a good time to have that discussion. It's still a very sturdy building. There are kitchen facilities over there. There's, and the questions they've had early on is, okay, how do we build this because we have other programs there? So there's a lot to discuss. But we're pretty committed to trying to find something and make that transition over. I think everybody is committed to that, and we're not going to let that go until we get that.
I have a question. My name is Maya Reed. I'm a resident of Hudson. I'm the commissioner lead for the city of Hudson, and have run youth programs in the city with Hudson Youth. And I am wondering about the fact that they are having to leave their space by November 30th and really asking for it to be extended that time period. I believe Bard's Early College is not being asked to leave that space. Am I correct?
Is that right?
Yes.
They're not being, and
Because there's a long-term lease with Bard.
No, I
through the
understand,
school
yeah,
year.
no, I understand that. So what I'm speaking to is the well-being of the youth, to have a space as the adults around them who are in charge of their programming, their well-being, have time to find the space, get it set up, and also prepare them for this move and this transition. It's critical to their mental health, their physical health, to feel safe. And right now that's what they have. And so anytime anybody, even for adults, a transition like this that's so sudden can be very jarring and very harmful. And so to be able to retain the young people and help them through this move by giving them the time into next spring, whenever the Bard lease ends. They're a good tenant. Mrs. Padilla has said they keep it clean. She's really spoken to that. So that's my request of the county.
All right, thank you, ma'am. Unfortunately, we have a time constraint. We have to go into executive session on another matter. So I'd ask the members of the public to vacate the room. Supervisor Mellon, would you like to make that motion? Would you like me to? Would you like to make your motion to go into?
Make the motion to go into executive session for a contractual.
I'll second it.
Further discussions? All in favor? Aye. Okay, we're back from the deep dark abyss of executive session. Any public comments? There being no public presence, I'm gonna ask for motion to adjourn.
Second.
Second.
All in favor?
We all in favor.
Thank you, everyone, for that free flow. Okay, I'd like to call the
Public Safety Committee to order, please, for October. First item on the agenda is police reform update. Firstly, I want to just apologize. I know we got you these forms late this afternoon, but,
Here's just a sample of one, pass them around, everybody got one?
so I want to thank firstly the chairman for putting this committee together, that worked on this, and thank you for putting me on it, Chairman. We had a very good working group. It took a lot of time. I came in late to the game. I want to thank Tistria. She was a tremendous partner in this. So I was happy to work with her and the whole committee. I think we've come out of this with a lot of good work. It has been a collaborative effort. The sheriff was involved. I want to thank Elena, the county's labor attorney. She was a tremendous help to all of us. So this is what we came out with in reference to the Citizens Review Panel intake form for complaint filed against the police agency. The chairman's going to just, it took so long, they just to make sure that the committee that he put together to review all of this is still 100% available. Policies and procedures are in here for addressing complaints against the sheriff's office. There's also a survey that's going to go out between January and March. So we wanted to try to get this to the committee again. We really were not trying to rush it. If we need more time, we'll wait. But we wanted to get it to the committee so that next month we could bring it in front of the full board with a resolution and get this in working order. So at this point, I'm going to turn it over to Tistria to add anything that I may have missed.
Yeah, so, because the survey is going out in January, we didn't want there to be confusion between the two. So in the police reform plan that this board adopted and approved and sent to New York State, two of the big ticket items that our police reform panel were tasked at was, it says there should be a citizen review board to take in complaints against police agencies in Columbia County that signed on to our plan. So not the city of Hudson, not the village of Philmont, village of Chatham, and wasn't there one more? City of Hudson, obviously not the New York State Police. So one thing was to create this citizen review panel, which the chairman did appoint, but then we had to kind of figure out a process, a procedure. We followed a similar process to the ethics board, knowing that these complaints are completely confidential. So although they are received by the clerk of the board, she does not open them. She date stamps the envelope received. They then go to the chairman of this panel, and they only get opened at a meeting of that panel, which is in confidentiality. And then depending on kind of the nature of the complaint, it could get sent on to the sheriff's office for an investigation through their normal process. If Elena needed to be consulted as to, this came in actually on the DA and it wasn't the sheriff, and, what do we do with this? So this panel will also have guidance from Elena, and we tried to break it down really step by step. So there's kind of 3 documents combined in one, and there's 2 versions of the document. One is for the sheriff's office, one is for the other 3 police agencies that signed on to this plan, and you would just check which one. So this intake form is filled out by the Citizen Review Committee when they meet and they open that complaint. And it talks about the date of the complaint, when it was received by Kelly's office, when the committee chair received it, and when the date was opened, which should be the same as the date of the committee member who was present at that meeting, the type of complaint. And then the actual complaint form is what the person would fill out and submit in that envelope. Summary of complaint, what do they think it was? And then there's a letter that the chair after the meeting would send to that person and say, we've received your complaint. We've sent it along to the sheriff's, or it wasn't delivered to the sheriff's because it wasn't related to the sheriff's office. And then this is really for that committee to follow step by step what happens with the complaints. And this goes out to the public too, so they understand that, yeah, even though you're sending it to the citizen review panel, it could go to the sheriff's office for their normal investigative process that they do in-house, again, depending on the nature of complaint. And so we spent a lot of time, the sheriff was on the committee. We worked for months and months working this all out. And the hope is that this committee would feel comfortable approving it so it can go to full board for November. If we're not comfortable with that, we can give it another month. It just runs the risk of
The survey, which is not a complaint process, the survey is like, hey, I went to the sheriff's office for this thing and they were great. Or, hey, I interacted with this and this was my experience, and we didn't want them to get confused with each other. And the survey is just a 6-week, January 15th, I think, to March 1st. Every year it'll go out and people can fill out the survey. So timing wise, I said, if there's any way to get it in front of this committee today so that the kind of press release of this new process doesn't get mixed in.
And we also understand this is gonna be a living, breathing, potentially document process. Things may come out of the committee and say, hey, this is a little bit, can we change that? But all of those things will come back to public safety at that point. And including the results of the survey that goes out January through March. We'll see how that works. We'll get the data and we'll review it with this committee.
And we'll get an annual summation of these complaints, so we won't get anything confidential. We won't get any details, but throughout the year, this many complaints were received that were of this nature, this many complaints were received that were of that nature. So it's really kind of a data collection tool for this committee.
I do have one question. On the very bottom of the front page, it has founded, unfounded, which makes sense. But then it says racism, and I'm not sure why that's there. I mean, because it addresses racism within the body.
Yeah.
I think that's a mistake.
Yeah, there's a racism, you're saying there's racism up above, why don't you have it double down here?
Yeah,
I
especially
think
with the
that's
status of
a
the
mistake.
complaint.
I think that's an error. So
Yeah,
at the
okay.
top should be, and another thing that we did discuss in the police review process, because we worked on this a lot, was that if I, as the complainant, say that it was sexual harassment, this box gets filled out by the committee. So this could actually differ. And so if it's, anyway, so the committee then gets to look at it and be like, oh, they said sexual harassment, actually this, but yes, that's a mistake, Chairman. Thank you for doing that.
Is this a billable form?
I don't know if we've gotten
What's
that
that?
far. Online
billable
fillable.
form?
I think we'll have paper versions.
So
and
Sherry's
online.
gonna work on that, and there's been some questions right now as to putting it on there, language issues, how do we put it on there? So that would be,
Well, that's the
No, this-
survey.
this
This one
is-
can't
no,
be
this
filled
is
out
not gonna
online
be
because
filled
it has
out
to be in
online.
an envelope.
has to be sealed in an envelope and
confidential.
dropped.
Okay,
Delivered.
I thought it looked like them.
Yeah.
I thought you did it and then printed it.
Maybe.
Could you explain to me, so once a complaint is filled out and handed into the committee?
Yep.
So then the committee goes through it to see if it's warranted or not warranted to move it forward or not forward?
Yes.
Yes.
Within 21 days of
Well,
the.
And again, the committee will have like Elena, if they need to reach out to Elena
Right.
for
Fully
guidance.
on board, right, stuff like that.
Yeah.
Okay.
But
And
if it's,
Just so you're aware, one of the people on the committee is the chair of our county ethics committee as well, so.
but essentially, if it is a complaint, for example, in the sheriff's office that normally would come in through the sheriff's office and be investigated, that same process is going to happen. This is really just kind of a third party for someone that might feel more comfortable than walking into the sheriff's office if they feel like the sheriff's office has done something. But at the end of the day, that process for investigations does fall with the sheriff. He has that full responsibility of investigating. And so we wanted that to be clear too, that, you know, just because you're submitting this to us doesn't mean that it's not necessarily, if appropriate, going to still go through.
And if the committee feels it's not warranted to do anything further, then you just say, no, it's not.
So I have a question. That's the committees, they can submit in the script department too.
What's that?
Complain, they can ask the review board and also sheriff department, anybody, police department. They can complain both place.
You're saying, can they do this one through the citizen review and then could they also put a complaint into the sheriff's office? I guess so. We wouldn't encourage that, but like, ultimately it'll go to the sheriff both ways and he'll see
Okay.
that it's the same complainant, the same investigation. And again, if it's Philmont, Greenport, Stockport, it's gonna be referred to them, to whoever.
The main reason
handles
behind this was for
complaints
those
there.
individuals that were not comfortable going to the sheriff's department. They felt, for whatever reason, that they didn't want to complain through the sheriff's department. They could do it this way, a little more easier access. And so that was the reason behind it.
And I think also the data collection, we talked a lot about that with, you know, the sheriff's office obviously is confidential. So if a complaint comes in and he investigates, he's not going to come to us and be like, I investigated these things. So kind of before it gets handed off, and there may still be ones that come directly to him that we don't have in our data. But it could be, wow, there's been, 17 complaints about sexual harassment. What do we need to get more training for your officers in that department? Or is there one officer that has had that complaint made against them multiple times, which again, he will deal with that internally. We as a committee aren't going to say, you're going to fire this guy or do this or do that, but really just to have that.
It's just a check and balances, basically, just another check and a balance, because he's got a lot of checks and balances in his office going on, so it's just something else that.
It was one of the things that got in the plan, this and the survey got in the plan through the process, because a lot of the public that came to those meetings and that, talked to the committee members, I wasn't on that committee, were kind of pushing for this more transparent, and external way to be able to bring up concerns.
So Chairman, I have a question then. What happened, I mean, this is all under the county aegis, so what if you have someone who has a complaint against the department that doesn't cooperate with your policy? Where will those complaints go?
Do you mean a police department or like?
Yeah, let's say I run afoul of the village of Chatham and I want to complain. This is my only medium to complain.
Right.
What will you do with that? What will the committee do with that?
So my understanding is that the village of Chatham did their own police reform plan, so there should be some follow-up steps in there that board of board of trustees.
City of Hudson did something, did all these?
Yeah.
They just didn't want to participate in it.
But they did their own.
They did
So
their
like the
own.
city of Hudson very well might have their own process with something like this, because they didn't sign on. Well,
So if someone were to say, come to this committee and say, I want to file a complaint against the city of Hudson, we refer them to the city of Hudson and say they have their own procedure, you need to go down there and see that.
Now, one question did come up and we asked Elena, like, let's just say that something did come in because this is sealed, we don't know what it is, and the committee opens it and it's on the DA's office or the village of Chatham or something that doesn't have to do with this. They would have Elena to consult because there could be a responsibility there and she would guide them legally that we need to pass that on to the village of Chatham, or we need to pass that on to judicial ethics if it's another judge. So at that point, Elena would be the one to look at it and say, okay, this is a serious, accusation, and we can't just go, oh, that's not ours.
Not us. But that's what I mean, I didn't know. At some point, when you see a complaint,
Exactly.
you have
But Elena will
a
be the one that
duty to do something about it.
Right, that was the concern. If something's brought to our attention that's, accusing somebody of rape,
Right, exactly.
we have an obligation to not to be like, oh, not our problem.
Not our rapist.
So that's what Elena's role will be. If something like that were to come up, the committee would call Elena and she would take it and get it to wherever was appropriate.
That's what I figured, but it's just.
Any other questions?
Are you
Good
looking for a
job.
motion to?
Thank you, yeah. If we're all.
Yeah, no, I reviewed it this afternoon and this has been a good discussion and I think the committee should be thanked and I would move to approve, these forms with the correction, one correction.
Yeah.
I'll
Might be
second.
others, by the way.
All in favor?
Aye.
Opposed? So carried. Thank you, everybody.
Thanks, guys. And
On a long process.
Yeah.
just to follow up on that, the last police reform implementation committee meeting was our last meeting.
Where will these forms be available, just for?
So they're gonna be sent out to all supervisors to put at town halls. They'll be at the county buildings and departments, available to print off the websites. Yeah.
Thank you.
And we were thinking that you could do maybe a press release with this and we can get it out there. Okay, public defender.
Good evening, everyone.
Good evening.
I just have one general resolution request this evening, requesting authorization for the chairman of the board of supervisors to consent to a one-year extension of distribution 11.
So moved. Second?
Second.
All in favor?
Aye.
Opposed? So carried.
Thanks very much.
Thank you.
Thank you.
Thank you.
Probation. How are you, sir?
All right, how are you?
Good.
I also have one request seeking authorization to accept the probation.
All in favor? Opposed? So carried.
You want us to accept money?
Thank you.
Raise your guy.
Raise all over that.
That's all I wanted to grant. I'm like, I just, right.
911.
Good evening. I don't have one, I have three.
Okay, first one, resolution to request authorization to accept the HMEP grant total.
All in favor?
Aye.
Opposed? So carried.
Second one, request authorization to accept the emergency management performance grant.
Second.
Grants, all in favor?
Aye.
Opposed? So carried.
Give me one once in a while.
Requesting authorization for the chairman of the Board of Supervisors to execute an agreement with Northeast Towers, the amount of $770,415 for this 3-site tower civil work, for the communication towers. We prepared, and properly noticed and published a request for bids for 3-site tower civil work, which includes site access road, buried electric and hookups, fencing, grounding, and concrete foundation. The sites will be placed in Chatham, Gallatin, New Lebanon to develop our sites. On October 13th, we received a total of 3 proposals from interested vendors. After reviewing all proposals that were received, we found that the bid from Northeast Towers in the amount of $774.15 was the lowest. Second.
All in favor? Aye.
Opposed? So carried. Last thing I have is, our agency call data. Incoming call volume for September of 2023 was 4,162 calls. In September, we dispatched 1,421 EMS agencies, 525 fire agencies, 1,941 police polls, and 499 public service calls. That's all I
Seems
have.
like those numbers are higher on all counts from 22.
Yes.
Any questions? Thank you.
Thank you.
Thank you.
Sheriff.
Evening.
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 Or even sit down.
Don't even sit down yet. You got it. Somebody else.
I can't see it. Here we go. Three resolutions, financial resolution to request to
All right,
accept.
move it.
Second.
All in favor?
Aye.
Opposed? So carried. Seconds for a child passenger safety grant.
Move it.
Second.
All in favor?
Aye.
Opposed? So carried.
And then a reimbursement for a total Jeep Grand Cherokee, total $39,980. Insurance.
Second.
Second.
All in favor?
Aye.
Opposed? So carried.
Thank you. Out of county inmate report, Franklin County received $5,400 for Franklin, $10,800 from Greene County. Ulster County, $2,550, total September of $18,750. Year to date, $275,435. Previous year was $1,815. Then, currently we have 46 incarcerated, 5 from Greene County, 1 from Ulster, 1 from Franklin, no federal incarcerated.
So how many from Columbia County?
How many from?
How many
46.
local?
So, that'd be 39. As is today.
Any questions for the sheriff?
I don't have a question. I just want to thank you for your help. New Lebanon had a security incident and I know you're very short-staffed and yet you jumped through hoops to help us out and it was very appreciated.
Absolutely, I'll pleasure.
Thank you.
Thanks, Sheriff.
Emergency management.
I know you're in a hurry, no resolutions.
You can go.
Great motion.
Well, I just wanted to thank you for, we did like a tabletop exercise if you wanted to frame it, but we did around cybersecurity. I found it really interesting. And I, as you were mentioning before the meeting, I think we're much better prepared for cybersecurity incidents than I think we were a year or two ago. So, but I also think that exercise was really helpful for all
We
of
can
us.
discuss it more next month and that.
It
was really well done.
Yeah.
It was very good, yeah. Thank you for attending.
Thank you.
Thank you.
EMS. You are.
You are. This list's complicated.
All right.
I wasn't able to attend the cybersecurity event, but two of my people went and they came back, and I just want to thank you because they came back with a whole list of things that we probably have to do, so.
They want more work.
Yeah, they did, but it was
Good
They,
work.
they were very enthusiastic about it, and it was very eye-opening, so.
It was
I
a
think
good group.
Had to be great.
Yeah.
Okay, basically, I just want to update you a little bit on the EMS Advisory Board. The EMS Advisory Board is dedicated every other month. We meet every other month, but in the months that we don't meet, we're dedicating towards working on the Fitch Consultant Report and how we can improve EMS in Columbia County and implement some of the recommendations that they have given to us. So at this month's, last week when we met, I basically kind of spelled out a vision that I thought maybe we should go in. We discussed it at great length, and obviously it's a long-term project, but Fitch's recommendation, their final recommendation is that there should be one EMS authority, would operate more efficiently than anything else. Recognizing the political atmosphere that's out there and the parochialism that's there currently with each squad. I basically went back and talked to Todd at Fitch and said, we basically have an EMS authority in place now. It's called the EMS Advisory Board, and we have Columbia County EMS system. He totally agreed and said, you're right, you do have that. Because this particular Columbia County EMS system actually answers to public safety through me. And the EMS Advisory Board actually is a subdivision or offshoot from this public safety board. So we actually have the structure in place to continue on. What we need to do is obviously enhance some of the things that the CCMS system stands for now by adding some performance guidelines and into our contracts that we have with existing agencies. And possibly beef up the advisory board a little bit, maybe with another one or two supervisors. So we did talk about that. My suggestion was that as we move along, that rather than the municipalities contracting individually with each of the rescue squads, that they should be able to maybe contract with CCEMS as a group, as an advisory group. So each town would contract with that. The CCEMS would turn around and then basically recontract with the existing squad that's servicing that area. Because one of the things that we found in this report, and after looking at some of the contracts with the towns, is that every town has something different in their contract. And some of it is very restrictive as to what we can do as far as moving ambulances, because some of the towns have written in their contracts, we don't want you to take an ambulance out of this particular area. Well, in order for the system to operate efficiently and effectively, sometimes it's a give and take. They have to move. So there are many things in there. The other thing I talked to them about was that as a board of supervisors, you're going to require audited financials. The financials need to come back. We're using, again, $3.5 million of taxpayer money, whether it's through your municipalities or through the county itself, and that there needs to be transparency. That was readily identified. And I was glad that it came from a third party, because I've been saying that for quite some time. The other thing I suggested is that as we move forward here, that when they come time for their budget request, actually one of the agencies suggested this themselves, that they not go before the EMS Advisory Board, which is made up of most of their members, but rather some of the public safety, just like we do any other departments, and talk about their budgets at that point in time. So I think that's a good suggestion. Lastly, it's important that we be able to recruit and retain medics and EMTs moving forward. The New York State, one of the New York State EMS councils just came out with a survey that they did that covered about 3,500 EMTs and paramedics, and the statistics were staggering. This report just came out in September, so you'll probably see it, but in here it said that 37% plan to leave EMS in the next 5 years, okay? But what's even more staggering is that 68% of EMTs and paramedics are considering transition to a different healthcare profession. Most of that is due to salary and benefits. And on top of that, it's burnout. So we need to work on a system together as a group through the CCEMS system to develop incentives and compensation packages where there's room for advancement of these individuals and hopefully incent them to stay and work on that as a group. Obviously, that's going to take money, but in order to come up with the money, we need to become more efficient as well. So it's a long-term goal, but I think it's readily identifiable. Kelly, do you want to pull up that other chart? The other thing is that we've been talking about for a long time is how do we create parity in paying for this service across the county? I mentioned to you before that I sit on the public safety group on NISAC, and have been really pushing for, to come up for the state to be able to allow counties to create EMS tax districts. And we came this close this year, so I don't know what will happen moving forward. But again, this is a what-if scenario here that I came up with. And basically, we've talked about coming up with taxable values, which is historically some of the chargebacks have been based on in your contracts with these agencies. But the first column there is the 2022 county taxable value by town. The second column is the current chargebacks that we are paying back to these agencies based on your contracts and the chargebacks with the county. So it comes to 2.3 million.
This is the second column is the money that the county is paying.
No, that's the amount. In other words, the city of Hudson is paying Greenport Rescue Squad 75,000, but we do it through the chargeback system. Okay.
Okay. So it goes under county tax bill about the local tax bill.
Yep. So the third column is the rate per thousand of assessed value that each town is paying. And you can see it is all over the board. Okay. Some are high, some are low, some are paying significantly nothing. So I did a what if scenario. What if everybody paid 25 cents per thousand of assessed value? The top line there, like Akron, would be paying $78,000, and it would flow on through to come up with a total of about 2.4 million. But again, the allocation that I think is the fairest, because you will see, is that the number of calls actually correlates to what municipalities should be paying. That's the number of calls in 2022 broken down by town, and based on the population on that 2.4 million. If we use that formula, those are the amounts that the towns would be paying. Now, obviously, some people are going to be jumping for joy as the rates go way down, and others will be, I'll put my flak jacket on. But again, we're just I'm looking for input from this group and the Board of Supervisors as to whether you think this is palatable moving forward. Now, obviously, if we did implement something like that, it would implement over a period of years, whether it be 3 years or whatever, because some are going down and some are coming way up. And I don't think you can do that one shot in 1 year. But in order to remain financially viable, our EMS system, and it was identified in the study, it's always going to need supplemental support from the municipalities and from the county. But how do we make that fair? Because right now, you're receiving the same service. It doesn't matter what agency appears in the city of Hudson, whether it's Glacier or Greenport or Chatham. It's all paramedic service. And how do we equalize that over the residents of the county? So again, this is obviously meant for further discussion, and it's a what-if scenario, but that's kind of the limited initial direction that I think that we should try to strive for to go to create a more unified type of system.
How agreeable we're all with the,
To be determined. Again,
still not really.
drip that out there.
Yeah.
I mean, I think everybody knows this is what we need to do. one of the comments was like, whoa, what are the supervisors gonna say about this? And one of the ones was like, well, are they okay if we move our ambulance out of our district? Well, basically that happens now, even though there's a contract in place, just to cover another area. You know, we move them like in between, and that happens now, but technically in some of the contracts, it says, well, you can't move outside of such and such, which is outdated and antiquated, quite honestly. Yep.
So one, I think population is a much more fair way than assessed value, because just because a town has nicer houses doesn't mean that they have more calls. They might even have less. And so I think that the model on population that then relates to the amount of calls, like you said, it tends to go in line there, is a much more fair way to do it. I do also think if we do a countywide model, which essentially, like you said, we're doing now, everybody should be paying the same amount, whether it's based on assessed value or population. So again, you know, New Lebanon only goes down 10,000. Like we're not that different. Again, there's some towns that go way up, some towns that go way down, but in fairness, that really is how it should be. There shouldn't be residents of one town paying, 10 cents and another town paying 60 cents and all of that money going to a shared service that everyone gets equal access to. So that I fully agree with. And again, I think it would have to be over time. We did something, as you know, recently with the 5 towns with Chatham Rescue, where we did I think it was a 5-year plan, right, Rob? Where we kind of equalized out to where more in line with where we should be. My second question is, if we went with this kind of, what I'm hearing you say is let the Chatham Rescue, Volusia Rescue, Greenport stay who they are, but instead of each town figuring it out, it comes in a more equitable way. But then who would decide, and these might be details you haven't worked out yet, but when I think about it, I'm like, okay, so right now the 5 towns get together with Chatham Rescue and we're like, what are your needs? We need a new building. No, we're not going to fund that. And so between rescue squads, right? Like what's to say like, okay, Volusia, now Volusia Rescue is going to get this chunk because we're going to give them a new ambulance, but Chatham's not. I just want to make sure that there's some, and I don't know if there can be a board made up of people that don't have some vested interest, right? Like in New Lebanon, I'm going to want Chatham Rescue to get more ambulances because they're the ones closer to me. So like, I think we have to look at that. How do we make those decision makers as far as how the budgetary funds, the pot that we now collect gets split out between them, and making sure that that is a fair and equitable process.
Well, I think that was part of the recommendation that we talked about, that let's just say for 2026, the combined budgets of all the agencies comes in 2.5 million, but their case is going to come, you're going to be the board that's going to decide that, not us, not the individual agencies themselves to say, okay, there's a member on the advisory board from Chatham and one from Volusia, blah, 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 okay? I think the fair way to do it is to come here like the departments come here for their budgetary request and plead their case, and then come up, we'll come up with a final, charge back a total budget for the system itself, and then it would be allocated according to population.
And then would it no longer be that Chatham Rescue is these 5 towns and Volusia Rescue is this 4 towns? Would it more be these 5?
No, they would
services
still
to-
have their own licensed area.
Okay.
But there would be nothing to preclude agencies from merging or doing anything like that. This has nothing to do with that.
And there
This
would
is just trying to get our arms around some transparency.
Yep, and there would be something in place to say, for example, if I'm Volusia Rescue and I'm taking ambulances constantly to cover for other areas, and Greenport's like, nope, I'm going to stay right here because this is where all the there's going to be some rules in place to prevent.
That's part of the contract.
Okay.
Yep.
Have these numbers been shared with the various rescue squads?
Yes. Last week. Again, what if? Okay.
I guess, well, I'm sorry. Okay, question. So let's start from the beginning, ambulance services. Is there enough ambulance services in the county right now to support the county from everybody? We have enough, even with the people that have moved in?
Yes.
Okay, my second question is, the towns like Clover, we have Pine Haven, again, has Whittier up there and stuff like that. How does that play in? Because don't they get a lot more ambulance calls into those buildings?
That's part of your town volume, call volume.
Okay. I'm just wondering how that works out. It's the same thing, because they have to pay for that, right? A lot of that is paid by them. Yeah.
Well, not Pine Haven or Whittier is charged, the patient is charged, right? So it's Medicare usually or Medicaid, yeah.
Okay. Well, firstly,
yep,
this is great, and I like the direction we're going in, but I'm still somewhat skeptical in regards to private entities, private, Valatia, Chatham, why they would want to get on board for this. What is the reasoning for that? They're right now, they run autonomously. They come to the towns. They say, we need X amount of dollars. Our 5 towns get together and we said, okay, they need this. We want to do this. But and I know there are some that don't even want to show their books. I'm not going to say who that is, but why do they want to get on board for this? Other than, in theory, this is a good thing. It sounds great, but I'm a private business. Why do I want you telling me how to run my business?
Sure. I'm not sure that they do. I'll be honest with you. Okay. This is a what if scenario.
Right.
It's a direction that I think that we need to go in. And right now, there isn't one agency in Columbia County that can operate without this municipal support and the county support. All right. And the cry from you as supervisors has always been, we need some transparency here. They won't show us our books, up and up and up and up. This is a way to do it. And they do need the support. I don't think it's unheard of. This really isn't, quite frankly, much different than what they're doing now. It's just a different way of doing it by coming and presenting their budget requests to you versus going to, Austerlitz or Ancrum or
Individual supervisors.
Right.
So how do we move this forward at a quicker rate? So every year we're the same thing, the group that I work with, right? Here we are and, it's budget time and we're going over, where are we going with this? And we try to get it together and we get a contract.
Yep.
Well, next year so how do we move this along to say, we have a goal for 2026 to put this in place? How do we get there?
25.
What's that?
I'm thinking 25.
Fine, but how do we get there? So who's on this group that's trying to get them together to form this? Just you.
Well, the EMS advisory board, okay.
Yeah.
I mean, I obviously sit on the advisory board and basically we were working with this Fitch report.
Yeah.
And how do we make this work without saying, okay, everybody throws whatever agency they are now, we're going to do away with those agencies and form one agency called whatever you want, XYZ ambulance service. That's not going to happen. Not right away.
So not that we want to force them, but do we need all of the services on board to transition here? Or is there the ability of the county to say, this is what we're doing?
You have the ability as supervisors to say, we want to contract with CCMS versus contracting with the individual agency.
Which then forces their
That
hand.
forces the issue.
If they want to continue to do business in Columbia County, they have to.
But ideally, we would get them on board.
They can continue to do business,
Right.
but they wouldn't get this, they wouldn't get the.
They wouldn't get the
municipal
subsidy.
support. Right.
So, Peter, I'm trying to understand
Yep.
how we reconcile this with the capital costs. We're gonna rein them in and say, we're gonna collect this amount of taxes, and we're gonna create parity. But the Fitch report basically required a redevelopment of buildings and equipment and people, a
No.
large capital investment.
Okay, that would,
How would we combine the two?
okay. The Fitch report basically looked at it as if we had no ambulance service in Columbia County whatsoever. If we were starting an ambulance service from scratch, this is where you would put the buildings.
So, but I asked that question, the consultant, and he said, these are the ideal locations. Yes, we would be moving existing locations within the county to meet that rotation. So that's going to involve additional capital costs. So we're going to ask these local agencies to fund the capital costs for these structural changes, but then we're also going to ask them to come to us with their budget approvals. That doesn't, I don't know how we reconcile that.
I don't know, we haven't got that far.
No, but it's a big piece of it.
Well, it is, but it's part of the total system.
I understand,
Okay, yeah.
but to Rob's question, I'm thinking about how do we transition, what does that transition look like? And how do we build a relationship that encourages them to participate in this transition?
We
So
have to
that's-
make them feel that they are part of the process itself, and that there are some incentives in there for participating in the system.
Okay. Well,
I'm not sure what all those answers are. yet,
No,
but-
no, but I
Yeah.
know that the feedback I'm getting has to do with how much money they'll have being determined by an outside body, but yet they're gonna be left holding the bag for all of the infrastructure and other, and
No, well, I
the
can't.
costs.
You.
That's what it's, that's the
History, and lock yourself
perception.
out.
It's the perception, that's all. I'm
Yeah,
trying to manage
yeah.
the perception.
That, I mean, we can't allow that. We have to figure that out. That can't be, no, could not let over.
But I think that it has to be brought to the organization before we can present the tax model.
Sure.
I appreciate sort of the long-term changes that we need to make to the system. I also think that if we not, I would assume that generally people from Hudson and Greenport and the towns close to the hospital are just gonna have, right now, are gonna have less costs. We can say we should have a system that's based on every person, like by population is the same cost. And I would imagine that that means across the board, the costs go up for the towns near the hospital and the costs go down from the towns far away from the hospital. And that's just like the mechanics of it. So the Hudson has the burden of having a hospital. You get the benefits and the burden of having a hospital. It's not on the tax rolls. That in essence, we're paying for the roads that go by the hospital, and we get the benefit of being close to the hospital. And so in some ways, to ask us to pay more, so there's parity around the county, the piece that I would want to have for our residents is how does this whole system benefit Hudson residents who are close to the hospital and probably have an easier EMS system to manage? And that's probably a conversation that's longer than this moment. But to me, I don't have that case. Like I couldn't go to my residents and say, hey, we can pay an extra, $100,000, and this benefits us.
160.
What?
160.
We can pay an extra $160,000.
Yeah, almost triple.
Yeah, so we can triple our costs. This helps us how?
Well, I mean, the case at the moment is, and I need to be politically correct, but in essence, you're not paying your fair share now. Okay, because it is a system. When Greenport has no ambulances in service, which is many times, okay, you're receiving the service from Chatham or Glacier or somewhere else. And being close to the hospital has nothing to do with it. It's really the call volume in the system that's driving the cost of the system as a whole. If we were to come back and say, okay, Greenport, we're gonna pay you, you have to put on 2 more ambulances every day. That cost would then go back to you and Clark and so on and so forth for just one agency. And that cost would be $1 million for 2 ambulances, okay? So there are we're trying to look at it as a system to keep the costs down for all the county. So we're using, 11, 12 ambulances per day versus if we went backwards and said, okay, we're going to staff enough ambulances for each district, you would be up probably to 20 ambulances. And that would drive the cost through the roof.
So I guess if I could see that, and I would imagine that the towns, the other towns that are going to have increases would want to see like a more detailed analysis about why that equals better service besides like the anecdotes.
Well, I want to say that it may not equal better service, but it's giving you service that would not be there if this system fails.
Yeah, I think I understand your point. Yes, I know when I started as supervisor, my town was paying $40,000 or $50,000 a year. Now we're paying 140 something. But that rescue squad was basically dying on the vine. So these rescue squads are teetering on whether they're going to make it or not. And I think we have to look at this, and I'm not saying Hudson needs to pay more or anybody else, but we have to look at this as we need to provide this service, and we need to make sure that these rescue squads are funded appropriately so that we can get service to our members of our community. How we get there, not 100% sure. I'm a little bit of a skeptic on some of this, but I think it is an overall, I think it's important that everybody in the county buys into this idea that we don't want any of these rescue squads to go out because God forbid we need a rescue squad, we need an ambulance, and we can't provide it because they're out of money. So I think that's also part of the discussion. And I think that's an important part of the discussion to talk to all the towns about. So.
And I think one helpful thing, if PJ could share it, is just to show Hudson residents, in 2022 or in 2023, 300 calls were covered by Chatham Rescue Squad, which is paid by these 5 towns. So these 5 towns were paying for your ambulance service, and we don't want to do that anymore.
Yeah, we can do that.
Right. So I think that would be a fair argument. It's not that you guys are going to get more. It's just we as other towns have been paying for coverage. And I don't know that Greenport ever comes out to New Lebanon, but I know that Chatham Rescue.
You think
They do.
I've got Chatham down Germantown.
Yeah.
Anyway,
My house personally.
I understand.
Those could be
I
some numbers
understand
that
that we
might be
can
helpful.
get those together.
Okay.
And again, this is a project to move forward.
I want to get out of here.
Yep.
Quick question.
Yep.
Is this almost like the fire firemen like we're dealing, you have mutual aid ambulance service where you're backing these other ambulance services. You have to move ambulances up to here to there.
Yes. Yes.
So it makes sense to all of us pay for it. Because the bottom line,
You're all
that's
receiving
just
the
how you
same
do a
service.
fare, but you're right.
Doesn't
That's
matter
what
what color ambulance appears in your district.
Right.
We have time to.
Yeah.
to finish
Yeah.
it.
Well, if you need help, ask for people.
This is just a dripping.
Thank you. Okay, good discussion. Any other questions? Any questions from the public? Any questions from the supervisors? Motion to adjourn.
Make the motion.
Second. All in favor? Aye.
Okay, everybody, thanks for joining us for the public transportation hearing. We have a few people online, so we're going to be both here and out in the internet universe. So I really appreciate you coming to provide feedback or to listen to other people's feedback. I'm just going to give like a short presentation, maybe about 5 minutes, about the sort of state of transportation and where we're at working on this public transportation plan, and then we'll open it up for comments. So the first slide, right? We've been working on a updated Columbia County Transportation Plan. So every county in New York State has these published plans that are approved by the State Department of Transportation. Our last one was approved, I think, in 2017, which was really written in 2012. So it's been quite a while since we've updated this plan, and we have a committee of agencies and supervisors that have been working to update this plan that both sort of revisits the services that exist and also identifies some priority actions. And we're excited about the work we've made, and we're happy to sort of share it with the public and to get your feedback before we submit it, so that way we can make sure that we're responding to people's needs. So next slide. This is the committee that worked on the committee. I should have introduced myself. I'm Michael Shimidas. I've been chairing the process. I'm the chair of the Transportation Committee, and I also represent Hudson's 3rd Ward. We also have a few people on the committee who are here. We have Rick Scalera, Hudson Supervisor, Bob Gibson, Head of DSS, Mike Johnson, who runs the Johnson Transportation, Matt Morrell, Chairman of the Board. We have Ray, who's head of Department of Public Works, Ron Knott, supervisor of Stuyvesant. So thank you all for sort of collectively working on this project. And we also have Kelly Picaro in the back, who's the board clerk and has also been sort of supporting a lot of this work. So next slide. The report sort of drafts off of a lot of the work that's already been done in terms of other plans. So this is the draft plan builds on the Columbia County Transportation Plan. That's the one that already exists. So we sort of did a lot of work of looking at that one and then evaluating what was the progress that we've made on that. How can we move forward? Next slide. The lack of public transportation. This is a, hold on, let me update the screen so I can see it. Hold on a second. This is from the Columbia County Workforce Plan. So one of the agencies that helps connect people to jobs, where it says, quote, "The lack of public transportation in our rural area is always an issue that limits not only access to the career center, which is at the community college, but also access to other workforce preparation services and job opportunities for many of our most in-need residents." So what we see is one of the reasons why we need public transportation is to ensure that people have job opportunities. Next slide. This is also from the county did a housing needs assessment in, I think it was in 2017, about the issues around affordable housing. And this is also deeply connected to transportation, where that report wrote, families who once rented homes and apartments near the urban centers of the county are thus forced to move farther out into the country, where they face transportation issues back to major centers of employment and to schools. And so this is one of these trends that we're seeing, where a lot of people used to sort of live closer to Hudson and Greenport and have since moved to farther parts of the county where there's less transportation services. And so this is one of the challenges that we've heard frequently, not only from this report, but from residents. Next slide. Part of the transportation plan is we did sort of a look at what is transportation services in the county. So last year, Columbia County Transportation Services provided 30,000 rides per year. But we also actually have a lot of transportation services beyond just the public transportation buses. These are things like Healthcare Consortium provides medical transportation where you call them up, make an appointment, they'll pick you up at your house and bring you to your doctor's appointment. And there's a bunch of different agencies that provide these transportation services. Some of them are run by and managed by the county, and some of them are managed by private entities. And these actually provided 40,000 trips to residents last year. So these point-to-point services beyond public transportation actually provide more transportation services than the classic public transportation. And so we're looking at both of these things. They sort of address different issues, and we know that people around the county need both of these offerings. Sometimes they need public transportation, and sometimes they need these point-to-point services. Next slide. We also sort of did like a review of public transportation by route across years. And so one of the things that we saw was that the shopping shuttle, which goes between Hudson and Greenport, has way more riders per mile than the other transportation services. We also saw a dip in ridership across the board during the height of the pandemic, with starting in 22, sort of like a jump back in with more rides. And particularly the shopping shuttle had like a significant increase that actually beat out the ridership in 2019, while some of the other ridership in 2022 was higher in 2022 compared to 21 and 20, but not as high as it was pre-pandemic. And going into 2023, we're seeing that continued trend of increasing shopping shuttle traffic. Next slide. As I mentioned, it's about more than just public transportation. The report does a review of many different agencies that provide transportation services. Thank you, Janelle. This is sort of like a list of all the different agencies that provide really critical transportation services in the county. Next slide. We also looked at sort of demographic data. There's some sense of we want to hear from people about what your biggest needs are, but we also sort of want to look around at the county and identify where there likely is the biggest needs. So things like where are the highest populations of people that don't have vehicles, because those are people who are more likely to need transportation. The biggest areas where that is Hudson, Kinderhook, and Livingston. We also looked at the places that have the highest density of people, because those are also places that you could be served by public transportation. Places like Hudson, but also Kinderhook and Greenport and Stockport. And we also looked at residents who are older. So residents over 60 are the demographic that are the primary public transportation users. People of all ages use public transportation, but the highest percentage is people over 60. And what we've also seen in terms of planning is that the 70 and over population is predicted to increase over the next few years and continue to increase over the next 20. So if we know that seniors are a major need for public transportation, we know that that need is going to grow over the next decades. So we want to anticipate that and meet that need. Next slide. We also looked at points of interest. Those are sort of like businesses or schools or parks, libraries, and major housing complexes. These are places that we could anticipate as being either major destinations or major origins for transportation. And as you can see, there's definitely some blocks of density, particularly around like the Hudson Greenport area, and also in the north around Kinderhook. But there's also dots like all over the county. So there's needs for people to go to places everywhere. But this is sort of a start of thinking about popular places where people need to go. Next slide. So this report, like the last report, it's not just assessment of where we're at, it's also an assessment of where we're taking priorities and putting them into an action plan. So the report evaluated our progress on our goals since 2017, and it sort of marked where it kind of didn't give a letter grade, but it sort of identified where we've made progress. And then it sort of reassesses and makes a new set of priorities, and then also puts them in buckets and identifies the priorities. So we named 7 sort of categories of things that we think are important to advance in transportation. The first thing is building internal capacity, is that right now there's no one staff member who works on transportation. Is it possible to mute that?
Is that somebody talking?
I think so. If you're meeting to ask questions, we'll ask questions in a second. So we're looking at how do we have internal capacity to sort of run these programs and to make sure it's successful. The second thing is how do we improve the existing services? The third is really making sure that we're effectively raising grant applications and reporting. The fourth is we want to not only improve the current systems, but how do we look at opportunities to provide new opportunities to take public transit, whether that means new hours or new locations. The fifth is we're really challenged by maintaining a high functioning fleet of vehicles. These vehicles need to get replaced frequently. We've had problems with the vehicles in the past, and we sort of need to get ahead of that and make sure that we're providing good vehicles for people to ride. The sixth is publicizing the opportunity so people know what opportunities they have. And seventh is improving rider experience. So even if you're on the bus, is it as positive as it can be? And then within each one of those 7 categories, we have a couple different action items. So maybe some of the people here, you have ideas that are either within these categories, or maybe you have new ideas that aren't in this category. So I'd love to sort of hear your reflections on these, or if you think some of these things are the most important things that we should address in the next coming years. I'd love to hear that. Next slide. As I mentioned, one of the priorities is to think about internal staffing. The mobility manager is something that was identified in our previous report as one of the top priorities, which is hiring a transportation staff who could manage all of these things. And it's still one of the key priorities for this report, because having a staff person who can work on these things means they can advance these other pieces that we need. Next slide. So here's where I come to the end, where we have this draft report. We'd love to hear from you. Here's 3 ideas of things you can comment on, is that you can comment on the plan, you can comment on your experience with transportation services, or you can make suggestions for improvement on transportation services in Columbia County. Or if there's something that you think is not within those, you can certainly say whatever you want. This is your time to share. You also can share written comments, and we're going to be accepting written comments through the 20th. We're going to aggregate all of these comments, revisit the plan, and then submit an updated plan based off of your feedback. So with that, I'd love to open it up for comments and questions. I guess I would just recommend, do they need to stand up to be heard on the mic, Kelly? Okay. All right. So if you just want to stand up, I guess I would recommend that you say your name, where you're from, whether or not you're a transportation rider, and then if you could just speak for 3 or 4 minutes about your comment, I'd love to hear that. Yeah, we'll start here on the end.
Hi, my name is Joe D'Antonio. I live in Hudson at Providence Falls. I use the Hudson shopping shuttle bus quite often to go shopping and to my doctor appointments. While on the shopping shuttle bus, I witnessed an elderly man fall going down the steps to get off the bus. I also saw a woman fall trying to get on the bus. The new shopping shuttle bus should be without steps, because it's cumbersome for both seniors to go up and down those steps to get on and off the bus. The CDTA buses have no steps. We would like to have a bus like that. They also have a lift that goes up and down the bus to curbside to let people get on and off, even with wheelchairs. It's even cumbersome for some seniors to use the lift to get on the bus. So I hope that you order a new shopping shuttle bus without steps.
Okay, thank you. I appreciate the comment. I'm gonna go to, there's a question online. I'm just gonna go back and forth between here and online. Kelly, how do I?
They should be able to talk if you have somebody there.
Okay, did I see that Nona raised your hand?
You only have 2 people on there, Jeremy and Joe.
Okay.
Did either of you have questions?
Do either of you have questions?
Yeah, Michael, I do have one. My name is Joseph York. I live in Hudson. I rely on the Albany and Shopper shuttles. You posted a thing a couple weeks ago about the funding for that's going to affect the Amtrak. Has there been any update on whether that's still in jeopardy? And also, as far as the Albany shuttle goes, maybe adding a couple a stop somewhere before getting to the plaza for people to deboard if need be. I know the first 6:15 and 2:30 go out to the government offices first, but the the 7 and 4 and 4 just go mainly around Capitol Plaza. So I'm just wondering if it's possible, you know, like add a stop like down closer to the arena or something to that route, or something like that in the future for those that are going to connect elsewhere to CDTA.
Thanks. I'll certainly circle back with the bus companies and sort of see what's viable around stops. So we hear that request. And I don't know about the answer about Amtrak funding.
Yeah, what time we start? Well, you can come to my house too, so you have to talk about that first. If you want to be at my house.
Did you want to go next? Did you want to go next?
Sure.
Yeah.
Hi, I'm Billy Joe Clement. I'm a frequent flyer of the Hudson bus system. I used to be a frequent flyer of the CTA too.
Okay.
For the most part, I really like the Hudson bus system compared to the CTA. But there's a few, mostly, there is nothing to do in Hudson. Yeah, and there's a couple things in the summertime that they actually provide in Hudson as an activity, like the music concerts in the park up in Greenport. But I can get myself there with the new schedule that they have, because they have later buses to be dropped off. But they start at like 7 o'clock at night for their music, and they don't end until 12 or 10. Yeah, so I didn't go to the park at all for the whole summer because I had no way back. And I was afraid to get rides with people who may be drinking and all that stuff. So, and I look forward to going to those parks, and they only operate like 6 weeks out of the whole year. If there was a way to, when they know there's big scheduled events, for the county, like even the fair, if there was a way to include them, because also these places are making money for the county as it is. So like Greenport, they rely on people buying stuff at their snack bar to pay for their band and their grounds, mowing their lawns and everything. So if there was a bus, maybe more people would go and then contribute to their economy of what they're providing. But other than that, but for the quality of the bus system that we have, the most polite bus system I've ever seen in my life. But that was the only thing. It's just, I barely ever get to do anything for activities. So I hope that you guys could include something like that.
Thank you for your comment. Want to go next? Yeah.
Yes, I live in Hudson. I report for, not on transportation. Anyways, I go to, county meetings, and I've heard, people, chairmen of departments and other high officials in various departments saying, we got to move our department out of Hudson. This is even when they're in a modern building like 325 Columbia. We had to move we got to move our departments to the industrial park area or to the wellness hub. And the Veterans Bureau has already moved out to Greenport. That's not as far, but some of these places, a lot of them, they're moving to places without public transportation. And like even the Office for the Aging wants to go to the industrial park area. And they're saying, we can always, maybe their attitude is, they can always provide a special cab or special senior citizen service. But instead, why not have, once more and more departments move out to industrial park, why not have a bus along the Route 66 from Hudson to Chatham and back, a regular bus several times a day that anybody can use. You don't have to be a senior citizen. You don't have to be with a special appointment to use. And also, at certain times of the year, one would be able to use it to go to the county fair. And the main thing would be going to the industrial park. But that's another point is to think about that if county offices moving to places with no
public transportation. That's something to think about. I mean, but the idea is to move the transportation to those places with the offices. Another thing, and this is just a little detail, is I've noticed in the RAF bus schedules, there's some of the newest shopper loop bus schedule, but there's also a whole stack of them from 2019. And somebody can easily just pick up the 2019 schedule. And shouldn't those ones from 2019 be ditched?
Those are great points. I appreciate that. Do you want to go?
My name is Janet Miller, and I use both the Old Betty bus and the shopping shuttle. I've been riding the bus since Mountain View, so I've been through all your companies. I have never had a problem with a company until this one. We were told to turn in our tickets, our white 10-punch tickets, and I did. And I still have tickets that the bus company has, they don't know where, that I paid for, but they haven't cashed the checks, so. But it's ridiculous to have to go through this. In order for me to get my other tickets back, the one that are payroll deducted through WageWorks, I had to go through the Attorney General. Because nobody knows anything, nobody wants to talk to you. There's no customer service.
Thank you. I appreciate the comment.
Yeah.
Anybody else before you go twice? I just want to make sure there's anybody. Yeah.
I'm Donna Marzell. I live in Hudson. I use both the Albany bus and the shopping shuttle. I've had recent problems with the shopping shuttle. First of all, I want to say that all the drivers in Johnston's Newport are very friendly. Lately, they've been using C5 for the shopping shuttle. It has a seating capacity of 14. They used it today. We were sitting shoulder to shoulder. It's flu season. COVID is out there. Even sitting shoulder to shoulder, there's no room for groceries. So it truly isn't a shopping shuttle when C5 is used. The other larger buses are going back and forth to Albany, sometimes with a capacity of 4 or 5 people. So it's confusing me as to why that is happening. I'm also having problems with the handicap seating and elderly seating. Maybe we need to educate the riders in general that those seats should be used by people who need them. And not by people who just want to sit in the front of the bus. Also with ProPark, I'm very happy with them. They send out notifications on cancellations for delays and road work. Now, Green Street has been being worked on now for 2 months. It was closed for a long period. The shopping shuttle was traveling all different routes. We had no idea what routes they were traveling. When I called Johnston, they weren't even aware that Green Street was closed down. So I'm hoping in the future, we can have a better system of coordination so that your riders are aware of where the shutdowns are and where the delays are.
Thanks. I appreciate all the comments. This is really helpful for me to understand what y'all have been going through and what it's like to ride. So I really appreciate that. Are there any comments that other supervisors or other committee members wanted to add at this point?
As a member of the committee, I also appreciate the comments and certainly
I see yeah, go ahead.
I want to thank the Board of Supervisors for extending the shopping shuttle hours.
Yeah, I appreciate it. So you've been using it. It sounds like. I appreciate that.
It's opened a whole new world for a lot of people.
Now they can get to work and get home.
another public transportation need is Columbia Green Community.
Mhm.
Right now, the only vehicle, one regularly there is the Green County, Route 7-Eleven, which is valuable. But of course, there, for more hours, for both students and professors, there could be.
So yeah, I appreciate, well, we're going to take sort of, we'll review these comments and sort of add it to our package in terms of this hearing and Kate taking notes, and then reevaluate the plan. I can reflect back some of the things I heard. I heard a concern around being able to get on and off the bus and making sure making sure we're meeting safety standards. I heard both appreciation for the more hours that we've added, but also a request to continue to have even more hours, especially on major occasions. I heard a concern around being able to access county services, a request that we add transportation to Chatham along 66, that we revisit our advertising of schedules and make sure that the old schedules get replaced. I heard a concern around ticketing and making sure that we have a fair process around when people are purchasing tickets and getting reimbursed for those things. I also heard a concern around the size of the buses and making sure there's adequate space for people to be able to sit, especially including handicap accessible seats and seats for groceries or luggage. And I also heard concerns around getting notifications when buses are sort of going off route due to construction or other things like that. So those are some of the, and I also heard a concern around accessing community college. So those are I think are some of like the big picture things that I've heard that's really helpful to hear these reflections. Oh, we also heard about a request to have more stops on the way to Albany. So those are sort of like the big picture things that I heard. We'll review in case I missed anything, and we'll make sure to sort of capture some of these concerns in your own words. But I just really want to appreciate y'all coming here and sharing your experience on riding. Any other comments before we close the hearing? Yeah, go ahead.
I would just like to thank Michael for leading us through this process and taking all the recordings and typing things up and keeping us organized here. So thanks, Michael. Good job.
Yeah, thanks. I appreciate that. It looks like we just got someone to enter the meeting. Hey, we were sort of just taking comments. Did you want to make a public comment?
No, actually, I sent an email, so I'm okay.
Okay, thanks. We did get that email. Appreciate you sending that.
Thank you.
Well, Ron, I think I appreciate the appreciation.
Okay.
No further comments. I'll close the public hearing. Thanks, everybody. Appreciate that.